Thank you. Dr. Oz, thanks for being here. Good to see you again. Certainly I'm excited about your process here. And I'll go along with John Cornyn there. If there is such a shot that makes you want to exercise more, I may have to wait until its generic brand comes out to be able to afford such a shot, because that should be really, really expensive for a short period of time. But to that point, I'm not going to ask you to comment on it, but my theory is that we need to have a long conversation about how expensive drugs are these days. But at the same time, we should have a similar conversation about how when drugs hit the generic market, they drop precipitously in price, and it's that way forever. So I would hate to, for the lack of a better way of saying it, shortchange the American people by focusing on the original sticker price without having the value proposition long-term over the ultimate cost of a drug when it's in the generic forms. I do think we're not really having a serious conversation with the American people about the fact that 94% of the morbidities that we face every day are on a generic medicine, and that because of that, you can go to Walmart or Publix or wherever you go and get a 30-day regimen for $4 or $10. And that value proposition that we bring to the American people because of patent protection is really important, though we very rarely focus on the back end that lasts for a lifetime and the front end that lasts for 5 to 12 years. And probably need to figure that out. But ultimately, protecting that patent protection is really important from my perspective, not necessarily need to hear your thoughts on it yet, but I am hoping that you will commit to coming to South Carolina and having a conversation with my folks in South Carolina about the job that you are going to have. Is that a commitment you'll make?
A commitment. My roommate from college is from Greenville, South Carolina, so it's a good excuse to see him too.
Well, I hope he's not a Tiger. Anyways.
He's a Tiger.
As a Gamecock fan, I knew he was. There's something about that thin air in Greenville that causes people to be a Clemson fan. For those of us listening to us, it is just a joke. I just lost several votes there, by the way, so I'll move on. I want to say thank you for the compassion that was woven into your opening statement. We are both men of faith, and I think those of us from a faith background share the philosophy that we find embedded, at least in the Bible, in Matthew 25, that we have a responsibility to help those in certain categories, whether it's the widow or those folks suffering and going through challenges. I think it's really important for us as a nation to embed that ethos in our approach to solving problems as a nation, especially for the most vulnerable. And your opening statements reflected that kind of compassion that I think we desperately need to see more of on our national screens around the country. To that end, the sickle cell anemia challenge that you talked about when you met with our staffs, thank you for bringing it up without having to be prompted to it. I do think that CRISPR technology as we know it today is going to transform medicine as we know it tomorrow. I'd love your thoughts on that, and I hope that you have a commitment in your new position to move forward with some of the cell and gene therapy access models that we're talking about, making it affordable for people stuck in Medicaid or Medicare, or not stuck, but on Medicaid or Medicare.
Well, Senator Scott, thank you for bringing sickle cell anemia and similar CRISPR solutions into the forefront. There's a lot that we have benefited from that is only there because we've incentivized innovation. And so sickle cell anemia, a disease which I've taken care of patients with because they often develop problems with organs that require surgery, is a crippling problem that causes a lot of pain, and then you die, but you spend a lot of money on the way. And there's this treatment, let's just say it costs $1 million. It's roughly the number that I'm hearing, that if we could offer these young children, often of African-American descent, this treatment, then they would be cured. So I think there are ways for us to amortize that cost to save the child's life and reap the benefits of them not being in the hospital, running up big bills while they die in pain. That seems to be a pretty good investment. We just have to get our minds around the idea of paying $1 million to save someone's life and demonstrating that if it works, that the drug company should get paid over a period of time to make up for the fact they made a massive investment to build that solution. Those are the kinds of innovations that I think we could bring to bear, where you could actually imagine medications only being reimbursed if they provide a benefit that we all agree is true over time. And just to the earlier comment, because you brought up faith in the broader issues, the oldest hospital that I'm aware of that still exists is in Cairo. And this hospital historically would take patients in. You wouldn't pay for care because you're sick, you don't have money. When you left the hospital, they would give you money. It's the opposite. Why? Because when are you going to have the least amount of money? When you're sick and you're getting better. So they would actually give you something to get going again. I think those are the kinds, at least metaphorically, ideas we want to support, to get people back on their feet again and then make them feel obliged, responsible, because it is a shared responsibility to our health system, to do what they can to stay healthy so the system works for everybody.
I know that I'm out of time, but I'll ask my last question and ask for a yes or no answer, if that's okay with you, Chairman.
Yes, go ahead.
Thank you, sir. During one of the silver linings, if there was a silver lining during COVID, and it's really hard to think of that catastrophic occurrence having any silver linings, if there was a silver lining in COVID, it was the development and the acceleration of telemedicine. And I think it's going to save millions, if not trillions of dollars over time. I hope that you are committed to doing as much investigation as necessary to make sure that telemedicine is not just here to stay, but that it is embraced and adopted throughout our country wherever it is practical to be used.
I pledge that if confirmed, I'm going to pursue telemedicine. I think it's essential, especially in our rural areas.
Thank you, sir.
Thank you.